So what are the tests which are normally advised for couples with unexplained infertility? So we'll start with the woman first. The first test is to see if she's ovulating. Normally a woman with regular periods is likely to be ovulating regularly, and no additional tests are needed. But there are certain tests like follicular study where we monitor the follicular growth and wait for it to rupture. Number two, measuring a hormone called LH, which is luteinizing hormone, which tends to rise just before ovulation and produces ovulation. And the third test is to measure progesterone, which is a hormone which is increased in the body only after ovulation. So it is usually checked on the 21st day of a 28-day cycle. So these are the tests for ovulation. So woman needs to be ovulating regularly, number one. The second test is for the tubes, to check if the tubes are opened or not. So that's important. And the commonly done test is called a hysterosalpingogram or a HyCO-C. It's both are similar tests, but one uses an X-ray and the other uses an ultrasound scan. So basically what it involves is injecting dye into the cervix from down below and watching the spill either on X-ray or on ultrasound to see if the tubes are open. Now, every woman with unexplained infertility does not require a diagnostic laparoscopy. So a laparoscopy is an invasive test which needs to be done under anesthesia and is reserved for those women who have a block which is diagnosed on a hysterosalpingogram or a HyCO-C, or women with endometriosis or previous ectopic pregnancies, or women who've had infection in the pelvis. These women are more likely to have blocked tubes. So for them, laparoscopy may be advised as a first test. The next test is to ensure that the uterus is normal. So for this, a simple transvaginal ultrasound scan is usually sufficient, and additional information may be obtained by using a 3D scan. This is to rule out problems like adenomyosis or cysts in the ovaries or fibroids in the uterus, etc.